So I'm going to give you a bit of insight into our logo. But before I do that, I just wanted to also speak about the topic of image in GP practice. So what I mean by that is the perception of the patient towards the doctor. So as I mentioned, we started with no patients. So every patient that walked in was a critical encounter that we had to impress and really serve well so that they would come back. So there's a bit of pressure there. And what I realized was that I was the product. And so people, as they come in, they are looking at you and examining you. I've got to turn on my light here. It's not on. Come on. Wait a sec. Don't do this, guys, if you've got a blog. There we go. That's better. So what I realized was I am the product. So I'm going to tell you a little story. A patient came in. This was quite soon after we opened, probably within the first few months, and he came in with a episode of gout. And so by this time I'm seeing maybe a handful of patients per day with a lot of gaps in between. So got some time to give some extra care, which helps when you're trying to impress. So the patient had a severe attack of gout, and the best thing for him at that time, because he had tried oral medication, was to give him an injection in the joint. And I can't remember what joint it was. I think it was his toe, and I said to him, well, you actually need an injection, but I haven't done one before, so I'm going to just do a little bit of research, if you don't mind, and then we'll do the procedure. So he politely said, no, that's fine, doc, do your research, it's okay. Inside he was, I imagine, thinking, what is going on here? Does this doctor even know what he's doing? So I went and quickly just searched on a very legitimate site how to do a intra-articular injection in the second metatarsal, in the metatarsophalangeal joint of the toe. And after I'd done the research, I did the procedure, and he left. Lo and behold, a few weeks later, he came back. I was surprised, really. I was surprised. But anyways, he came back with gout again in another joint. So the fact that it was in another joint meant that I hadn't done an injection in that joint either. So a strange thing happened. I said to him, you need an injection, but I haven't done one in this joint yet. So let me do a little research. He said, doc, last time your injection worked, so please do your research. So he ended up as a patient of ours, and he came back many times. I mean, I did refer him to a specialist because of the recurrent gout attacks. So he saw a specialist about that. But the reason I tell you this is because the dynamic of trying to impress but still trying to be truthful and be honest about your abilities and that you don't know everything is a very fine line to walk. And that's one of the things which I've had to learn the last few years. And thankfully our patients have been very gracious with the areas that as doctors don't necessarily have full knowledge in, but I will never forget something a colleague of mine said, who was a year before me at medical school. He said, if you love the patients and if you care for them, then you're going to be okay, because obviously you're not going to do anything to them that's going to hurt them. You're not going to go outside of your expertise, and you are going to give them the best care. So a little bit of insight into our logo. Actually, this video is going on a bit long, so I'll chat about that next time.